This presentation is from SRM Dental College, Department of Pharmacology. I am Dr. Vinodhini. I am going to discuss regarding the mechanism of antibiotics resistance. So, we are going to discuss regarding antimicrobial resistance. What is this antimicrobial resistance? See, the organism, when we are using the antibiotics against the microorganisms like bacteria, fungi and virus, protozoa, etc., these organisms will stop responding to the antimicrobial drugs, whatever we are using against them. So why this is happening? How these organisms are escaping the action of the antibiotics? It is mainly due to the end result of the misuse of the antimicrobial drugs, or what we commonly call as antibiotics. So when the physicians are prescribing the antibiotics, the patients are not taking or adhering to the schedule of the physicians and they misuse the antibiotics. So sometimes they overuse the drugs. Enthusiastically they themselves take many times a drug, or they take one or two drugs on their own self-medication, on over-the-counter purchase of the antibiotics. So overuse, misuse of this antibiotics has led to this global problem called as antimicrobial resistance. So why this has become a problem now? So because since the microorganisms are not responding to this antimicrobial drugs, the patients are not responding to the treatment. Even to the simple infections are becoming complicated and the patient's death rate has increased. So due to the unavailability of the non-availability of the newer antibiotics in the recent times is adding up to this problem and leading to the occurrence of resistance. So this again add up to the problem, and now antimicrobial resistance has become a big global problem and the patients are not responding to the antibiotics. Now what makes this antibiotic? These are the result. The antimicrobial resistance is due to the result of misuse or overuse of the antimicrobial drugs. So what makes the organisms to find out the ways? What are the different ways by which these microorganisms are escaping the action of the antimicrobial drugs? Mechanism of resistance. These microorganisms are finding different ways to resist the action of the antibiotics. So broadly, this mechanism can be a genetical basis of the resistance. Because of the genetic basis of the microorganisms, they can produce the resistance against the antibiotics, or by biochemical basis, by finding out the different alternate things that is available as a biochemical basis also, these microorganisms can resist the action of the antibiotics. Genetic basis of resistance. Microbes or the microorganisms, some microbes have innate or natural resistance against certain type of drugs. So because of their genetic makeup, they will be naturally able to resist, or some drugs may not be able to act upon certain organisms themselves. Then the acquired, by way of the action of the drugs, after a period of time they find out certain ways by which they can resist the action of the drugs. That is, for every antibiotic to act on it, it needs a binding site. So that binding site, if it gets altered by the mutation, then that mutation can lead to the non-availability, non-binding of the drug, leading to the development of resistance. So this mutation which is acquired in one organism may get transferred to the organism, other microorganisms of the same species. Like if it is developed in the Staphylococcus, from Staphylococcus to the other staphylococcal bacteria, it gets transferred. That we call it as vertical transfer. Okay. Second is the gene transfer. This one is a very dangerous one, horizontal transfer we call. Why we are calling it as a very dangerous one? Because it's from one species, from one bacteria to other bacteria, like from Staphylococcus to Streptococcus. Like that, these gene materials are getting released from one bacteria, that is finding a way and getting in, but this gene material are being getting into the other bacteria, and because of that different genus or different species of bacteria are getting developing the resistance mechanism on their own. So how this is happening? This gene transfer can occur when two bacteria gets conjugated and the transfer of gene materials occurs, or when a bacteriophage induction, when it is getting infected with the bacteriophage, via the transduction of bacteriophage, this genetic material are getting transferred. On transformation, via the transformation action into the other bacteria, it is getting these genetic materials which are acquired resistance are getting transformed to the other bacteria. So this genetic basis, especially this horizontal transfer, is a dangerous one because it is getting transferred to the other types of bacteria. So all the bacteria, not only one type, the other bacteria also getting the mechanism how to resist the action of the antibiotics. So biochemical basis of resistance. So the biochemical means by which the drug microorganism can resist the action of the drugs. First thing is by producing the microbial enzymes. The bacteria are able to release certain enzymes which has the capacity to destroy the antibiotic. Like this is the bacteria. Actually, when the antibiotic is entering, when we are giving antibiotics, it is to any antibiotic has to enter the bacteria to produce its action. After entering, this bacteria is releasing the enzymes. So what happens? All these enzymes will target the drug, and after some time, the antibiotics in themselves are getting destroyed. So no antibiotic is available to produce the action. So by this there is inactivation of the antibiotic. The second mechanism is reduction in the permeability or entry. So when any drug has to act, as I already told, this drug has to enter the bacteria to produce its action. So when this entry or the permeability of the antibiotic into the bacteria, if it is getting affected, so that leads to the non-entry or the non-permeability of the antibiotic. So since no antibiotic is entered the bacteria, it may not be able to produce its action. So no antibiotic and no action, and the bacteria survives in our body. The third mechanism is expulsion of antibiotic by efflux pumps. So how this is happening? So when an antibiotic is given, it is able to enter the bacteria, but after entering, before it produces its action, there are some efflux pumps that are getting expressed in the wall of the bacteria that push out the antibiotic whatever is being ingested. So because via efflux pumps, this antibiotic whatever is entered in bacteria is going to be expelled out. So again no antibiotic will be available to produce its action. The fourth mechanism is the alteration of the proteins. It is a binding site. Here it is more specifically we can explain with the penicillin binding proteins. These penicillins are the wonder drugs which are able to produce wonders in the treatment of the infections in the patients. So when these drugs are given, they go and bind with the proteins which are available in the bacteria. So they are very specific about their target site, and the binding site is very specific. So when they enter, they go and bind with the binding site. Then they start producing the alteration, all the other consequences or the sequences of events occurs to cause. So altered penicillin binders, as we saw with the previous slide, the binding site has to be very specific for the drugs. So by any means the bacteria has been able to produce this mechanism, and it's found out its way to alter the binding site. So if the binding site is altered and if it is not specific to the penicillin may not bind with the drugs and lead to the absence of the action. Even the drug enters, it may not be able to produce its action because of its inability to bind with the altered binding site. This is how the other way by which the bacteria are resisting the action of the drugs. So the last mechanism, how they are, the broad mechanism, how they are able to escape the action of the drug. So there are some many metabolic pathways that are being available. Our antibiotics act on this crucial metabolic pathways of the bacteria, and because of the non-availability of these crucial things which are needed for the metabolism of the bacteria, they will die. But in order to escape the action, they find out brilliantly, they find out the alternate pathway in order to survive. By then they escape the action of the drug. So somehow they produce the alternate pathway and they are able to somehow produce the DNA. So then they are able to survive and escape the action of the antibiotics. So the first mechanism, we saw the 5 different mechanisms by which the bacteria are able to resist the action of the antibiotics. First thing, to express the enzyme; second one, to prevent the entry; third, to even after the drug is able to enter, it will be expelled out by the efflux pump; and the fourth mechanism by altering the binding site of the drugs; and fifth one by developing some other pathway to synthesize their DNA. So among this, the major mechanism of resistance, or a very harmful mechanism to resist the action of the drugs, is the expression of the beta-lactamases. So this beta-lactamase, in order to make the beta-lactam antibiotics available for action, they found out the drugs called as beta-lactamase inhibitors. So the role of this beta-lactamase inhibitors is to inhibit the beta-lactamase which are expressed by the bacteria in order to destroy the antibiotics. So these drugs were acting very effectively and they were able to destroy the beta-lactamases and make the availability of the beta-lactam antibiotics to act on the bacteria. But the main tragic point is now its combination is also not effective nowadays. How? This is due to the development of this new metallo-beta-lactamases NDM1, which has been expressed. The combination itself is being destroyed. So, and not only that, they are able to hyperproduce the NDM1. This NDM1 production has led to a scenario that the superbug, this NDM1 has been called as superbug. Now this combination itself is not able to produce the action. This clavulanic acid, sulbactam and tazobactam are the beta-lactamase inhibitors, and tragically these drugs are not able to inhibit the superbug, that is NDM1. There is one type of beta-lactamase, and destroying the action of the combination itself. So we have to understand the seriousness of the mechanism of resistance, and we should be able to the global problem that actually underlies the development of resistance, and we have to be more responsibly use the antibiotics, and in order to we have to be cautiously using our antibiotics whatever has been available. Thank you.